Imagine this. You're 42 years old. You ran a marathon last spring. Your back's been a bit sore for a few months. Nothing dramatic. Your GP sends you for an MRI, just to be safe. 3 days later, you're in a clinic and a doctor reads the report aloud. He says the words L4, L5 disc degeneration, and facet joint wear and tear. You stop running that week. 6 months later, you can barely walk for 20 minutes without your back locking up. Here's what nobody told that person. About 50% of pain-free people her age have that exact same MRI finding. The words on the page weren't a diagnosis. They were a description of normal aging. But the words she heard in that room, degeneration, wear and tear, those words went straight into her nervous system and rewired how her brain talks to her back. Today we are talking about something the science is now overwhelming on. The words your doctor uses about your body and the words you use about your body are not just labels, they are biological inputs. They change pain, they change healing. They can erase nearly half the benefit of a real treatment, or they can double it. Once you understand how, you'll never let a casual sentence in a clinic do that kind of damage to you again. Welcome to the Wellness Bridge. I'm Gary Chen, physiotherapist and founder of GC Integrative Physiotherapy and Wellness on the Gold Coast. This is the show where Western science and Eastern wisdom meet, where the lab meets the breath, and where we find balance in one wholeness. Today's guest is someone I've wanted on the show for a long time. Dr. Liam is a Gold Coast-based clinical psychologist who works almost entirely with people in chronic pain. He spent 15 years sitting across from patients whose pain became worse after they walked out of a doctor's room. Dr. Liam, welcome to the Wellness Bridge.
Gary, thank you. It's an honor to be here. And the story you just told, that's not a rare case. That's the story of 9 out of 10 people I see in my practice.
Let's start there. Why is one sentence in a clinician's room so powerful?
Because the brain is a prediction machine. Every word you hear about your body becomes data the brain uses to forecast danger. There was a beautiful piece of research published in 2017 by Karan and colleagues. They ran a simulated patient study. They took virtual patients with low back pain and randomly assigned them to receive imaging reports written in different ways. One group got standard reports, another group got reports with altered language and prevalence data, a third group got no scan at all, just good information from their clinician.
And what happened?
The group that got no scan had the most positive perceptions about their back, better than every imaging group. The group that got enhanced reports, same findings but written with phrases like common and pain-free individuals, had higher satisfaction and significantly less fear of movement. Same body, same MRI machine, different words, different brain.
So the scan isn't the problem. The story we wrap around the scan is the problem.
Exactly. And it gets worse. There's a meta-analysis from 2023 by Webster and colleagues that looked at 89 studies on what's called the nocebo effect, the negative twin of the placebo. Negative expectations triggered by a clinician's words can cause measurable biological worsening of symptoms. The effect size was medium, 0.522 on the standard scale. That's not a feeling. That's a clinical grade dose of harm delivered by language.
And the strongest predictors of that harm, what were they?
Higher perceived dose of exposure and explicit suggestions that the exposure triggers symptoms. Translation: the more confidently a clinician describes harm, and the more authoritatively the patient receives it, the more biological damage the words cause. White coats, deep voices, scanner reports, all amplifiers.
Give us a number that's hard to forget.
A randomized clinical trial published in 2024. Patients with topical pain treatment, the researchers measured nocebo expectations going into the trial. The patients with high nocebo expectations, meaning they walked in expecting harm, had 2.5 fewer points of pain relief on the standard 0 to 10 scale. Their response rate dropped by 42.7%, and they reported 22.4% more side effects. Let me say that again. The expectation alone, driven by language and prior framing, erased nearly half the benefit of a real treatment.
42%, that's the difference between a treatment working and a treatment failing.
But here's the encouraging side. There's a meta-analysis published in 2024 on pain neuroscience education. That's the field of teaching patients about how their nervous system actually creates pain. Pooled across multiple randomized trials, mean pain dropped from 5.89 to 3.03 on the same 0 to 10 scale. Disability dropped, fear of movement dropped, catastrophic thinking dropped, and those gains were still holding at 3 months follow-up.
So if scary words can break the system, accurate words can heal it.
That's the entire thesis. The International Association for the Study of Pain recognizes that pain itself rewires the central nervous system. The Professor Lorimer Moseley, Australian World Authority, has shown for 2 decades that when someone lives with persistent pain, the nervous system stays in a high alert state. The neurons that fire when you're in danger become more sensitive. He calls it the facilitation of protective neurotags. It's why patients in chronic pain start to hurt with less and less provocation. Language is one of the most powerful inputs into that system. Because when a doctor says your disc is degenerated or you're bone on bone, the brain doesn't hear an MRI report. It hears a threat, and the alarm system gets dialed up.
Liam, this is the moment in every Wellness Bridge episode where Western science meets Eastern wisdom and they shake hands. What you've just described, the scientific evidence on language in pain, Buddhist tradition has a name for it. It's one of the 8 steps of the Noble Eightfold Path. Right speech, the teaching that words are not just descriptions of the world, they shape the world they describe. In Taoist medicine, the practitioner is taught to never speak harm into a patient's body, not as superstition, as clinical discipline.
And what we now know from neuroscience is that those traditions were correct. Right speech is not a moral nicety, it's neurobiology. The words a healer uses are part of the medicine or part of the wound.
There's another piece of research that I find almost mystical. A team in 2025 used large language models to analyze the way chronic back pain patients spoke about their bodies. The patients whose language was full of words like hope, acceptance, present, and sharing. Those patients had 30% pain reduction during treatment. The patients whose language was full of anxiety, avoidance, actively seeking, 3%. Same treatment. The difference was the patient's inner vocabulary.
Your own self-talk is a clinical exposure, just like a medication, just like a posture. Your inner monologue is dosing your nervous system every minute of every day.
Let's give the listener something they can use tomorrow morning. 5 practical shifts.
1. Reframe pain as protection, not damage. When you feel a flare-up, replace "my back is wrecked" with "my nervous system is being overprotective right now" but I am safe to move. That single sentence changes the brain's prediction. Try it for a week and notice what happens.
2. If a doctor sends you for a scan, before they read the report, ask one question. What percentage of pain-free people my age have the same finding? Most of the time, the answer is 40 to 70%. That single number diffuses the report's power to harm you.
3. Audit your own language. For 1 week, write down every word you use about your body. Crippling, destroyed, ruined, those words are clinical-grade nocebo doses you're delivering to yourself. Replace them with neutral language. Tender, sensitive, still figuring out movement.
4. Treat the metaphor. The best metaphor for chronic pain isn't damage. It's an alarm system that's gotten too sensitive. The pain is real. The alarm is real. But the alarm doesn't mean fire. It means the smoke detector needs recalibrating. And the way you recalibrate it is gentle exposure to the movements you're afraid of, plus better sleep, plus calm breathing.
5. Prioritize sleep, stress, and gentle movement before another scan. There's a study published in Nature Human Behavior in 2025. Tagliaferri and colleagues, over 500,000 participants. Biological markers like blood tests and scans were poor predictors of pain. Psychosocial factors, sleep, mood, life stress, were far more accurate. The next scan probably isn't going to give you the answer. The next good night's sleep might.
Liam, the line that's going to stay with me from this conversation is this. The words a healer uses are part of the medicine, or part of the wound.
And the words you use about yourself, Gary, those are the medicine you take every single day. Choose them with the same care you'd choose a prescription.
If today's episode landed, send it to the person in your life who is one MRI report away from giving up on their body. Save it for the next time you're sitting across from a doctor and a sentence is about to land in your nervous system. Remember, together we find balance in one wholeness. I'm Gary Chen. This has been the Wellness Bridge. Until next time.